morning.
Hi,
Hi, Dhruvi. Hi,
I am Dr. Malay.
Hi, hi.
It's good to see you at Goa on Sunday morning.
Yes, after a long time.
Yeah, શું ચાલે પ્રેક્ટિસ કેવી છે આજકાલ?
All good.
All
Post COVID, it seems that we are seeing a totally different kind of a practice. Like, what's up with how is it in Rajkot?
Yeah, it's now comparatively very well. Previously, last year is very, very dangerous and hazardous. There is no any bed and there is a lot of patient, COVID positive patient, and very uncontrolled type 2 diabetes patient.
True.
But seems it's nice. There is a very, very less number of patient of COVID, and I think no one. I think there is no active case in COVID. How's about Ahmedabad?
Specifically, when I see my practice post-COVID, because of either COVID or some medicine or some alternate therapies during the COVID time, and people's awareness or willingness to do more reports, ऐसे क्या देख रहे हैं कि there are so much increase in diabetic kidney disease. When we do a routine checkup, we see the creatinine on a higher side. There is some albumin urea. There are in some patients, though there is no albumin urea, there is still a kidney disease. So how you are observing?
See, people, don't tend to understand that it is not just diabetic kidney disease that they are dealing with. It can be a contribution because of their uncontrolled hypertension also, which is a part of their whole complex of the chronic disorder. People don't understand that it's also that their lifestyle has changed during the COVID times. Their food habits have changed. They've not gone to their doctors, in the regular time. And, all of this teleconsult also has not made us or not allowed us to do the diagnostics or the lab work as we used to do it before.
Yeah.
How you are dealing in Rajkot with the
Yeah.
patient come with the diabetes, which is uncontrolled with some degree of hypertension and with kidney diseases?
Because last week one patient came in my OPD. It's a type 2 diabetes since 10 years, and so diabetes is not controlled.
Oh.
And previously only fasting and PPBS report done. There is no any blood reports done. So I just did the blood report like serum creatinine, and it was more than 2. So EGFR is very, very less. So patient developed the CKD, chronic kidney disease. So uncontrolled type 2 diabetes is directly correlated with the chronic kidney disease, and both are, if the patient had diabetes and CKD, so there is a heart disease prevalence is very, very high. So we have to educate the patient to control the diabetes, proper diet management, and there is now new molecules come in the market, previously not available. So what your experience?
But again, I feel that patients have that prejudice કે તમે મને દવા લખીને એ દવાથી મને કિડની પર અસર થાય. It's not the diabetes or it's not their uncontrolled lifestyle which is causing the troubles with their kidneys, and it is quite hard to counsel them that it was not the medications that have caused your kidney trouble. It is the constant uncontrolled sugar, constant uncontrolled blood pressure, and your lifestyle probably that contributed to your kidney disease. And it's not the medications. I think we've encountered this.
The basics remains same. When you are dealing with chronic disease or metabolic disease, the lifestyle modification remains the center stone of the treatment. Whether you have diabetes, you have to control sugar up to the mark, you have to control the blood pressure, you have to control the lipids, you have to control your waist, you have to control your body weight. But for only 3 things can prevent progression of metabolic disease or chronic disease. There is monitoring, and monitoring.
Absolutely.
Yeah, so it is a key to halt or prevent the progression of any diabetes or kidney disease.
So I think we should tell our patients and tell the people who have diabetes as well as hypertension or cardiovascular disease, like you said, that you get yourself checked regularly. Go to your doctor or ask a healthcare professional that what should be done, kya reports karawa જોઈએ, or for that matter, when should I get my kidneys checked, or can I get my fundus checked? People with diabetic kidney disease also have a retinopathy trouble. So when should they get their eyes checked, or when should they get their heart checked? Get a simple ECG done.
Most important thing is kidney disease are very common that we have to understand and make our patients also understand. Do the reports of kidneys very regularly, do the monitoring, and there are 2 things that you highlighted કે diabetes ના કારણે જ કિડની બગડી કે તમારી દવા લેવાથી કિડની બગડી એવું નથી. There is a પાર્ટ ઓફ કન્ટિન્યુઅમ ઓફ આ ડિઝીઝ કે પેથોફિઝિયોલોજીમાં અમુક સ્ટેજ પર કિડની બગડવાની જ છે, દવાના કારણે બગડી એવું આપણે ડેફિનેટલી કહી શકીએ નહીં. અને સેકન્ડ થિંગ, ઓલ ધ કિડની ડિઝીઝ ડુ નોટ રિક્વાયર ડાયાલિસિસ. ઘણી વાર પેશન્ટના મગજમાં ફિયર કિડની બગડી ડાયાલિસિસ ક્યારે થશે, અને એના કારણે દે આર સો મચ સ્કેર્ડ. સો વી હેવ ટુ મેક ધેમ અન્ડરસ્ટેન્ડ કે ઇટ્સ અ પાર્ટ ઓફ આ કન્ટિન્યુઅમ ઓફ પેથોફિઝિયોલોજી, અને દરેક કિડની ડિઝીઝમાં ડાયાલિસિસની જરૂર પડતી નથી હોતી.
મોસ્ટલી ડાયાબિટીસ ઇઝ અ સાયલેન્ટ ડિસીઝ.
Yeah.
સો મોસ્ટલી પેશન્ટને કોઈ સિમ્ટમ્સ હોતા નથી.
Yeah.
તો વોટ પેશન્ટ ફીલ કે મને કઈ તકલીફ નથી તો મારે શા માટે ચેક કરાવવું જોઈએ.
True.
બટ જ્યારે ડાયાબિટીસ ડિટેક્ટ થાય છે ઓલમોસ્ટ ત્યારે 50% આપણા બીટા સેલ ડિસ્ટર્બ થઈને મોસ્ટલી કોમ્પ્લિકેશન ડેવલપ ચાલુ થઈ ગયા હોય છે. લાઈક રટાઈનોપથી આંખ ઉપર અસર થવી, હૃદય ઉપર અસર થવી, કિડની ઉપર અસર થવી, અને પેરિફેરલ આર્ટરી ડિસીઝ, સ્ટ્રોક પણ આવી શકે. સો સૌથી ઇમ્પોર્ટન્ટ છે તમારું ડાયાબિટીસ કંટ્રોલ કરો, ડાયટ, લાઇફસ્ટાઇલ, અને જરૂર પ્રમાણે રેગ્યુલરલી બ્લડ શુગર રિપોર્ટ ચેક કરાવતા રહેવા જોઈએ અને ડોક્ટરને બતાવતું રહેવું જોઈએ. સો વી કેન પ્રિવેન્ટ ડાયાલિસિસ, એઝ તમે કીધું મુજબ. ડાયાલિસિસ ઇઝ નોટ રિક્વાયર્ડ ઇન ઓલ કેસ ઓફ ડાયાબિટીસ વિથ CKD.
Don't you think the fear is more important here? Patient comes to us with a certain kind of, prejudice in the mind. Oh my God, how is my kidney good? That's the point that they have, and it's the first prerogative of us as doctors to tell them that progression of diabetic kidney disease can be stopped. There are appropriate medications that we can give. There is appropriate diet, exercise, and lifestyle. You can exercise. You can have your proteins. There are so many notions and so many, misconceptions. Okay, my kidney खराब है, so I should not be eating say XYZ proteins, or I should not be having salt intake so much. Of course, salt intake has to be restricted, but people are very scared. They are in a constant state of fear कि भाई अबे यार डॉक्टर पैसे जाइए so ये हमारी किडनी ने savage, they are going to stop it. That's the thing I think.
Again, at this point of time, I would like to say it's an era of specialists. In a disease like diabetes, in a disease like kidney disease, and when they are together, we need to have a holistic approach. In our team, we need to have a diabetologist, diabetic educator, a specialized physiotherapist, and whenever required, take an opinion of nephrologist. When your diabetologist says hey, you require an opinion of a nephrologist, you must go and seek the advice and follow both the advice of diabetologist as well as kidney specialist, and that will definitely help.
Very truly said.
Absolutely.
Because diabetes is a holistic approach. All teamwork is required. And it's most important right now, kidney friendly nephroprotective medicine also available. Earlier it's not available.
Yes.
And in this patient, insulin is the best treatment. So whenever required, go with the insulin because it is the ultimate final and the treatment of choice in CKD with diabetes patients. Right?
Insulin कायम નું નહીં થઈ જાય is something that we will tell them.
But when your doctor says કે insulin જરૂરી છે ત્યારે ઘણા પેશન્ટને આ કઈ આર્ગ્યુમેન્ટ કરવાની જરૂર નથી. Let them decide for you. When you are trusting your doctor, they are going to do the best for you. And insulin is not only a therapy which requires continuously. There are some patches in the life of diabetic patient કે જ્યારે વચ્ચે એમને ઇન્સ્યુલિન આપવું પડે, જેમ કે કોવિડ વખતે જરૂર પડી હતી, કોઈ ઓપરેશન વખતે જરૂર પડે છે, એમ સર્ટન પીરિયડ ઓફ ટાઈમ ઇન કિડની ડિઝીઝ ઓલ્સો દે રિક્વાયર ઇન્સ્યુલિનાઇઝેશન. અને પછી આપણે હવે નવી દવા છે જેમ તમે કહ્યું મલયભાઈ કે એને આપણે ચાલુ કરી શકીએ છીએ, that will help.
Absolutely.
The last important point is CKD diabetic patient is more prone to develop the hypoglycemia. So આપણે એને એવી એડવાઇસ કહેવી છે તમારે રેગ્યુલર શુગર ચેક કરવું જોઈએ જેથી કરીને શુગર ડાઉન ના થાય. એ સૌથી ઇમ્પોર્ટન્ટ છે.
Absolutely.
And not just sugar monitoring. Measure your weight, measure your blood pressure, get your creatinine and EGFR regularly done.
And urine albumin creatinine
Urine
ratio.
albumin creatinine ratio. Get your fundus checked. Get your ECG done. So some very, very basic profile that can be explained and taught to the patient to be taken care of. So screening and monitoring are the key.
Yes, of course.
So it was nice talking to you guys all in the morning.
It's a wonderful weather at Goa, and let's do something that can help our patients to live a better life, longer life.
With quality of life.
With good quality of life.
Yeah.
Vaccines.
Okay, vaccines are very important. When there is some disease like liver disease, kidney disease, there is a splenectomy or other immunocompromised disease, we must promote vaccination of our patients.
Especially
so how often you are?
Patients with kidney disease.
Yeah, in Rajkot, how's the practice going on for?
Because like COVID vaccine right now and one the booster dose also available, and some pneumococcal vaccine is also available. So it's more and ideally indicated in this patient to give the vaccination.